No Jamaican should ever have to hear no beds available, sit on a chair. It's time for urgent and comprehensive reform in our healthcare system to ensure all Jamaicans are afforded basic human dignity.
I'm very disturbed by what I've heard, and I've ordered investigations into them. They should come to me at Cabinet next week with a full report. But these are issues that as your government, as your Prime Minister, I take them very deeply to heart.
Bless up my people. Welcome back to the channel. It's a girl and Isabel Rose. Thanks for all the new subscribers. Thanks to the returning subscribers. If you're new to the channel, subscribe, turn the post notification bell on, put it on all so you won't miss an upload from me. On the road to 20k, help me to get there, my people. So in this one, my people, we're seeing where Christopher TUFTON, who is the Minister of Health, basically in the hot seat right now, as we're seeing many opposition members coming against him as it pertains to what they see as a poor health system currently going. And even the Prime Minister has launched an investigation as it pertains to ventilators and a 4-day-old newborn who have passed because of no ventilators in a particular hospital. Stay tuned for the details at hand. Don't forget to like, share and subscribe to the channel. Run over to my other platform. Subscribe over there. Get that channel to 1k for me. Please and thanks. Some people, following the recent death of a woman's mother at the Falmouth Hospital and a 4-day-old baby at the Mapen Hospital due to lack of ventilator, we're seeing Chris TUFTON, the Minister of Health, under the hot seat right now, my people, and many members from the opposition side coming out, my people, speaking on this poor health system that is currently ongoing. And so I'm going to hear the story of this lady and how her mother passed away, basically grieving, blaming the healthcare system, blaming the negligence of, even the powers that be to sort out the healthcare system that is basically dilapidated in Jamaica right now. Take a listen.
Christopher TUFTON, the hospitals in Jamaica short a bed. It's short a bed and people are dying. People are dying even when they can get help. And it is a very sad state for the country to be in. Any country that cannot provide good medical health is going nowhere. Is going nowhere. Alright. Result come back by 10:30. We say we need to get her to move now. When I went back to hospital, to farm hospital, we say, alright, how are we going to transport her? Can we get a JDF helicopter? I say, what's the procedure? Ma'am, we are trying to work out her to move, but there is no ambulance again at Falmouth, so we're trying to get an ambulance from Montego Bay. I say, can we pay for private? Dr. S. Dixon, go and tell me, if you even pay for private, no nurse will want to go. I say, but be serious. Before we reach there, sir. Monday night, when we went to look for my mother, remember, so she admit for a Saturday morning. The nurse said, Miss, there's only 2 pills left, 2 imodipine left. I said, what you mean? 2 pills left. We bought a week's supply for $95,000. Miss, there's no pill. I said, what do you mean, say there's no pill? I said, the pill can't last. I said, I want to find the pill. Then last, my mother pill, or to me, then teeth my mother medication, I say, what do you mean, say the pill last? I say, on the search, I gave the nurse the pill for 1 week supply. Every 4 hours, 60 milligrams. You remember that pill that we paid $95,000 for? Then say, alright, we're going to search, we're going to investigate who was on duty, but describe the person. Then say, call nurse's supervisor officer and report the case that the pill is lost, or in this case, stolen, or thief. When we call nurses supervisor office at Falmouth Hospital about 8:30 the night, because after visiting hours, someone tell me say she only have 2 pills, and 2 pills is 1 dose because one of the pills is 30 milligrams. So that means say if it's every 4 hours, Jamaica, she would miss at least 3 doses over the course of the night, and they already delay her. You understand me? She would miss 3 doses. Me say, no, this I get from bad to worse. Me say, no. Me say, this too much. This too much for the family now. This too much. Anyhow, because me like follow protocol, me call nurses' quarters and report the situation. Ma'am, you call at a bad time. I say, excuse me? Excuse me? That is at about 8:30 tonight. Me say, I'm telling you that the hospital couldn't provide the pill to treat my mother at first. We bought it for $95,000. Give it to the hospital. The hospital lost the pill. And me I report it and you tell me, say me call at a bad time in Jamaica. Well, I heard of the matter. We are investigating it, but there's nothing that we can do at this time. I say, what you mean? I say, tell me. I say, want you tell me, say, you know, go provide the pill. At least get the night supply until it's search and find. You got miss, well, sorry. We can't do nothing about that. You have to come back in the morning. I say, but what is? So, of course, you don't know. Me have to go back to hospital Monday night. And I have the video and I go release the video where me talk to the nurse. You understand me? So, me say, only if you lost my mother pill. Them no know who put you. Me say, don't you have a pill tray to put pill for that people get to treat them family members? Eh? Miss, we don't know. So what go on tonight? We don't know. Then treat people life like garbage at Falmouth Hospital and the whole medical system. You understand me? When she went to Kingston, so we got the ambulance to take her to Kingston. She got to Kingston Wednesday at UWI Hospital. UWI can't believe. They said, when they admit your mother, me say Saturday morning 5:15. UWI cannot understand. The doctors up there, the team, the neurosurgeon team, can't understand how they have her so long and never ship her off. They can't understand. When she reached her town, she too late. My mother lungs start collapse, her heart start collapse. My mother dead. My mother dead. Dead. You understand me? Because of the heap of delay and back and forth. And I want this to blast. I want everybody to learn about this. Me not eat. First you go in the hospital, me can't eat. You understand me? My mother dead. Died. Friday after 12. Or if you want to call it Saturday morning. Because when Kingston get her to perform surgery, they couldn't do it. Everything start to fail. And she go in the hospital for Saturday. Tell me now, Jamaica, what kind of health system this in 2024? Eh? This must blast. This must blast because it could be your family member. It could be a long time. Me go hospital and then short her bed and me wallet, but this gone too far. All I keep hearing in my head, my mother they cry and say me head, take off. And that doctor Wilkins at farm go say, Mom, you have to wait. See there? You have to wait. She dead. She dead now. And she could have gotten help, but because of the neglect, no machine at their Falmouth. You hear me? Wanna blast this to me. This medical system kill off my mother. And people need to know. Gloria Smith Paris, I hope you come out of pain now. You suffer at the hand of the medical system. But her pain done now. She dead. Her pain done now. Now blast this for me, Jamaica. Blast this for me.
Following same, we're seeing opposition shadow spokesperson on health, Mr. Dawes, come out, my people, questioning the whereabouts of some 105 ventilators that the government has received during the whole COVID-19 era. And so he basically is saying that he does not intend to politicize recent tragedies affecting public health system users, but the government must be reminded that mismanagement in the healthcare sector is paid for in human lives. He says refurbishing and painting clinics and hospitals will not improve healthcare if the system is broken. This is merely putting lipstick on a pig. We must fix the system because failing to do so will result in repeated tragedies. Meanwhile, in the same breath, we're seeing Nikisha Burchell basically coming out saying that the whole healthcare system needs to be reformed and that her father was a victim of the poor healthcare system.
Cornwall Regional Hospital has become a symbol of the severe inadequacies and inequalities in our healthcare system, where patients are left to languish without basic care. 3 weeks ago, I visited a constituent suffering from serious diabetes-related complications who had been admitted nearly a week prior to my visit. Shockingly, we couldn't locate him on any ward, only to discover he had been sitting on a chair in the accident and emergency area for the entire duration, nearly a week. He wasn't alone. Numerous other patients were found on chairs, the floor, and even on cardboard. One man in severe discomfort was seen forcing his way through a hive of family members trying to see their loved ones with his urine collection bag and other medical trappings as his back was strained from sitting for days upright on a chair, he said to me. This past week, I was approached by a desperate family seeking help to find a bed for their mother in Kingston. This middle-aged woman is suffering from a brain tumor, and while she has insurance, still she cannot have surgery due to the lack of beds at Cornwall Regional. Fast forward 3 weeks after my last visit to Cornwall Regional to see about constituents, and my own father faces the same dire situation. He's a stroke victim, faced with no beds and forced to sit on a chair at Cornwall Regional Hospital. This isn't just about my family. It's about the countless Jamaicans who cannot afford private healthcare. I represent a constituency of proud, hard-working people, farmers, market vendors, public servants, good tax-paying Jamaicans. When they fall ill, who do they turn to? They cannot afford private care. Should they have to beg for a bed when they're sick? Should they play Russian roulette with their lives? Are we comfortable with the glaring inequality in our healthcare system? Can we confidently say that today for me, tomorrow for you won't apply to us tomorrow or today? Over the past week and a half, people from across Jamaica have been sending me voice notes, messages, photographs, and videos documenting the appalling conditions of hospitals and healthcare facilities in their areas and the treatment their relatives have been receiving. It breaks your heart to hear of the loved ones who have died on chairs, who have been refused surgeries due to the lack of beds, equipment, or staff. The 500% cost overrun from 4 billion to 21 billion and the 7-year delay in the completion of the rehabilitation of Cornwall Regional Hospital demand immediate accountability. The government must provide transparent explanations for these overruns and delays and take swift action to expedite the completion of the hospital's rehabilitation. No Jamaican should ever have to hear no beds available, sit on a chair. It's time for urgent and comprehensive reform in our healthcare system to ensure all Jamaicans are afforded basic human dignity. This is not just a call for change, but a demand for the basic human right to health care. Time come.
Also, amidst hearing of the whole tragedy, Prime Minister Andrew Holness has also ordered an investigation into the whole, absence and the whole ventilator saga, and says that it's a bit worrying and troubling when the people cannot get to benefit from the healthcare.
I'm very disturbed by what I've heard, and I've ordered investigations into them. They should come to me at Cabinet next week with a full report. But these are issues that, as your government, as your Prime Minister, I take them very deeply to heart, and we commit to doing everything within our powers to ensure that every single Jamaican that needs health care can get access to the health care that they need.
And some people may not go draw out that video here too long, so me I go make go right into the comment section and talk up based on everything that was said in this video. Tell me what you think. It's really, really a sad one to see so many persons have to be losing their lives, losing their loved ones due to, lack of space in hospitals, lack of trained personnel there, specialist personnel at that, and equipments, you name it. And so, lives are being lost due to this poor healthcare system. So I want to hear from one of my people. Don't forget to like, share, and subscribe to the channel, or run go over to my other platform, Instagram and Facebook, and follow me over there at Anisabel Rose. Check out the YouTube store, make a purchase, it goes in support of the channel. Check out the YouTube membership. You get a lot of benefits by becoming a member. Member shout out, member badges, only a small fee per month to join the Anisabel Rose movement. Thanks to all my returning subscribers. Thanks to the new subscribers. Thanks to my new viewers. Come on board, journey with me, join the family. Subscribe to the channel, like up the videos, share out the videos, support the ABR movement by playing a part. On the road to 20K, help me to get there, my people. Get this video to at least 2,000 likes for me, please. As I come up on the videos, then please to like and share. Stay tuned for more videos. Stay tuned for more updates. Big up on yourself.